Thank you for being here this afternoon. It is my privilege to give another update to the people of our great state. As you see today, I have brought some additional folks that have been working day and night to help our response to the state of Mississippi. Today I have with me, obviously, Dr. Dobbs and Director Michelle to the far left and the far right, but also have Dr. Clay Hayes to my left, who is the current president of the Mississippi State Medical Association, as well as Dr. Claude Brunson, who is an anesthesiologist by training, but is also the executive director of the State Medical Association. And so I'm going to call on them as we move through this press conference so as to let the people of Mississippi know and understand the level of expertise and the quality of the people that are working to keep our people safe. Today, at 5 o'clock p.m., our shelter-in-place order begins. That means that you must stay home except for essential travel or individual outdoor activity. You can go to the grocery store. You can go to the bank. You can get what you need to get by on any day. You can go for a walk, or you can go for a drive by yourself. But you cannot gather with groups unless it is truly essential, because that's how the virus spreads. Don't be around strangers or even friends that you're not already in constant contact with, like family or your roommates. That is what we are trying to avoid. I know that this will not be easy. I also know that working together, we can do it. We are Mississippi, and we can rally together to slow down the spread of this virus. We're not afraid of hard moments. We step up during tough times. You're protecting your parent, your spouse, your friend, your neighbor, and more by committing to follow the rules. You're protecting yourself. And I'm here to tell you today that this virus is bad. Previous generations were called to world wars. We were called to stay at home for a little while. I miss church. I miss sports. I miss hanging out with friends. I know you do too. It's not fun, but it's the right tool at the right time to protect us from this enemy. Our shelter-in-place order will be enforced. It must be taken seriously. Lives are on the line. I want to put some minds at ease, though. If you try to comply with the spirit of the order, you're going to be okay. You don't need to fear some overbearing government action. We are asking our law enforcement officers to understand that this is brand new for all of us, and most are trying to get it right. Mississippi is still not China, thank God. As I said before, think of it like the speed limit. Law enforcement will be breaking up those gatherings or outings that willfully, knowingly, and blatantly go against the order. But most people won't have an interaction like that. Those of you who drive 66 on an interstate with a 65-mile-an-hour sign most likely aren't going to get pulled over. But those of you who drive 88 and run through stop signs are going to draw the attention of the police. We also need people to stay vigilant against the spread of misinformation. There were people spreading flyers in communities and online that threatened martial law enforced by our men and women of the National Guard. That is simply not true. There will be more false information out there. Get your facts from us on our social media or from one of these briefings and trusted news sources. I've said it before and I'll say it again. We are never going to break news or spread official policy through a meme on social media. I can promise you that. As we ramp up towards a very painful part of our cycle, our daily focus is the scaling up of our healthcare system. We need equipment, and there are people working tirelessly to secure that. We also need to mobilize our incredible healthcare workforce. They are on the front lines. They are risking their health to protect all of us. We owe them a lifetime debt of gratitude. We are going to have to be nimble and flex resources to areas that need it. We just had a very productive meeting about that with some of our state's leading physicians and leading hospital experts. So I'm going to turn it over to the experts at this time, leading the heroic effort to talk about what we're doing. First, I'm going to ask Dr. Dobbs to give us an update on where we are in Mississippi, and then we'll turn it over to some of these other folks. Dr. Dobbs?
Thank you, Governor. Just as a quick update, we did have 181 new cases reported today with 3 additional deaths, bringing our total to 1,358, now with 29 total deaths. Again, we see rising case numbers over the next couple of weeks, and so this is really crunch time. This is when we really need to be prepared. The health system is really anticipating a surge over these next couple of weeks, and it is so very important for everyone in the public to make sure they do everything they can to fall within the confines of that shelter-in-place order. The only other thing I wanted to show you guys was I brought you a ventilator to look at. So this is a portable ventilator. We have 500 of these that we have. Now these are battery powered, and these are really portable ventilators, but we have shipped these up to Mississippi State to convert to AC power so they could work more like a conventional ventilator, and I'll turn it on for you, and you hook oxygen and air into it, and then it comes up this side and supports the ventilator circuit. So we should have, this is not certainly the ideal scenario when it comes to the modern computer-driven sort of ventilators that we have, but it certainly is a fantastic and sufficient option for most folks who sustain respiratory failure. Thank you.
Thank you, Dr. Dobbs. Obviously, as we move into this next phase, we are looking at the information, the data, the models that suggest that we are going to see more and more cases in the days and weeks ahead. It is incumbent upon all of us to prepare for that. You can do your part by staying at home and practicing social distancing and only leaving the house for essential travel or essential operations of businesses around the state. For us, that planning comes in twofold. One, an operational phase, which we met on today, as well as a strategic phase, thinking about every scenario, the most likely scenario, and are we properly staffed with both equipment and individuals to meet the needs of Mississippi, but also looking at the worst case scenario and trying to find innovative measures and innovative ways to deal with that. As we look at the number of ICU beds that are available, we look at the number of ventilators that are available, and then ultimately the number of innovative solutions like Dr. Dobbs just mentioned, where we have the potential of bringing on 500 additional ventilators for our healthcare system. The main thing here in slowing the spread of this virus is making sure our healthcare system doesn't get overwhelmed. Not only do we need to understand the equipment that we need, we also have to understand exactly what the workforce looks like that we're going to need. And so I asked Dr. Dobbs and Dr. Clay Hayes to meet a day or two ago, and they did. And Dr. Hayes convened a group of specialists and experts, including Dr. Brunson here earlier today, and they've made tremendous progress in talking through the issues that need to be addressed. And I'd like to ask Dr. Hayes to say a few words today about that.
Excellent. Thank you so much, Governor, and thank you for the opportunity to serve our great state. The physicians are anxious to step up, and we know a lot about preventive medicine, and we know a lot about how to take care of people that are really sick. We developed years ago something called the Mississippi Healthcare Alliance, which takes care, and it's the #1 state in the country that takes care of patients that have trauma, heart attacks, and strokes. And so we thought we have that model to take care of patients that have COVID. So we're in the process of developing the COVID system of care, which involves the teammates, the other team members. And it's not just physicians, it's also the important work that nurses are doing on the front line, respiratory therapists, the blood bank, hospitals, all sorts of resources, the EMT personnel that are out picking up patients and taking care of the people of Mississippi. And we look forward to implementing that COVID system of care. And that's who was involved earlier today. Members of all those different personnel, they were anxious to help us, and we looked forward to put that in place quickly.
Right, and let me just say that if you are a nurse sitting at home in Mississippi today, or a respiratory therapist, and maybe you took a little time off or you retired, if you are ready to come back to work, now is the time to be thinking about that to help us get through this crisis. We are going to work to bring every healthcare resource available to Mississippians. Again, I know when times are tough, Mississippians step up, and I know that those individuals that have served for many years in our healthcare community are going to be ready to step up and help us get through the coming weeks and maybe months. Dr. Brunson, also the Executive Director of the State Medical Association, a longtime physician and really a longtime friend of mine. So Dr. Brunson, will you talk a little bit about the meeting that was had earlier?
Well, thank you, Governor, and as Dr. Hayes, our president, said, thank you for your leadership, and Dr. Dobbs for all the great work that you're doing on behalf of Mississippians. Let me just say the Mississippi State Medical Association, our organization of physicians in the state, we have been working tirelessly trying to get the state prepared for what may be a surge. The meeting that we just had, where we convened a number of experts from across the different disciplines that are going to have to step up and help us coordinate the care. The good news that we have is right now, Governor, with all of the physicians that we have in our state, and with the number of elective cases that have been postponed, we actually have a glut of physicians. And we are reaching out to those physicians and asking them to be ready and to be prepared. And they have given us word that we're here. We're not seeing elective cases. Whatever we can do to stand up and step up and be ready, we're here and we're prepared for that. So we've got a committee that we put together that are getting these physicians' names and where they're located and what they'll be able to do to step up and help us when the surge comes, if it comes, and the care that they can provide. We have also been coordinating with other healthcare professionals and agencies such as the Mississippi Hospital Association. We've had meetings with the Board of Nursing and the Board of Nursing Workforce, the physician workforce, as we're trying to plan through what might happen and how we'll be prepared to take care of Mississippians. So a lot of good work is going on. I think we are as prepared or more prepared than most states in the country. And Governor, your executive order has done a lot to help us be able to meet that need when it comes. It's inconvenient for folks, and we understand that. But this is going to save lives. And we appreciate your leadership and Dr. Dobbs' leadership and Mississippi physicians and other healthcare professionals who are ready to stand on the front line and take care of Mississippians.
Thank you, Dr. Brunson. I think what I want to reiterate here is these two gentlemen to my immediate left and immediate right represent literally thousands of healthcare workers all across our state that are going to be ready to step up. Many of them are already treating COVID-19 positive cases in every community throughout our state. When we look at the data in the most likely scenario, as I've told you repeatedly, trust me, we are looking at that. We are planning for that, but we are also going to plan for the worst, pray for the best case scenario, and expect somewhere in between. But we have teams of people back at the Mississippi Emergency Management Agency that are planning for that worst case scenario, what it would look like. When you think about the challenges that exist, if you determine that you had enough ventilators within the state of Mississippi to meet what ultimately may be the demand, well, that's just the first step. The next step is then making sure that you have the right number of ventilators in the right spot at the right time. And so from a logistics standpoint, that's one of the things that we're working through now and are planning for as we move into the weekend and into the early part of next week. I would like to recognize our director of the Mississippi Emergency Management Agency, Colonel Greg Michelle, to give us an update on some of the activities that they are performing.
Thank you, Governor. Appreciate that. Just a little update. As I mentioned yesterday, our PPE is starting to come in at levels a little more comfortable than they were 3 and 4 days ago. I just got an update from my logistics manager that we had about 75,000 more masks come in this afternoon, as well as some other disinfectant wipes and hand sanitizer things that certainly continue to be needed, and we've got orders that will be coming out throughout the weekend. The governor mentioned that strategic planning group had met and briefed him out today on plans that have been put into place with information that has been provided from our physicians, and we certainly appreciate that very much. It's extremely helpful in being able to prepare for that expansion should that case be there. So been a lot of activity going on at the Mississippi Emergency Management Agency. Be working this weekend. We've got another very large push of supplies that's been going out all day today to our Tier 1 facilities. Approximately 67 healthcare facilities will be receiving Tier 1 supplies throughout the day and even into the evening. And then we had a number of pushes that went out to the counties today. So we are, as it is coming in, as the supplies are coming in, we're pushing it out as rapidly as we can.
Thank you, Director Michelle. Obviously, we know that there are limits and constraints with respect to PPEs, and no one is getting everything that they ask for, but we are constantly getting more and more masks and other critical gowns, sanitizer, other things in. And as we get them in, we are using our distribution network, utilizing the resources of the Mississippi National Guard and others to get those to our critical facilities. That is going to continue. My commitment is to work every single hour of every day until we get all of the equipment that our facilities need. We're going to continue to fight that battle. It is a battle because every other state and every other country across the globe is working their contacts and trying to get more, and there is a limited supply across the land. But we are, I believe, getting more than our fair share in this, utilizing the supply chains and the contacts that we have built up over many years. We're going to continue to do that. My hope is that we are successful in ensuring that as we move into receiving more and more cases each day, and quite frankly, obviously, as we see more and more cases, we're going to see a higher number of individuals that need critical care, and we've got to be prepared for that. So with that, I'm going to thank everyone for being here and open the floor to a few questions. Ross, I think your hand went up first.
Dr. Dobbs, Mississippi is not expected to see the peak until for about a month from now, about early May, is that right?
You know, that's the tough thing. There's so many models out there. If you look at the University of Washington model, which is similar to the one that the White House and Anthony Fauci used most recently, it puts us really more around April 20th or maybe late April.
And do you expect the death rate to rise significantly in Mississippi?
Yeah, unfortunately, yes.
How much? I mean, we're less than 30 right now.
You know, it's hard to say. It's very hard to predict. You know, it'll certainly be much more than that. I mean, some of the models show us hitting as high as 1,000 deaths. Some not as much, with a lot of variability. But wherever that is, it's going to be a lot more, unfortunately. But everything we do now to prevent transmission is going to save lives.
And that number is based on a shelter-in-place order. If more people limit their interaction, social distancing.
You mean the anticipation of less deaths, or?
No, the anticipation of about 1,000 deaths.
Oh, yeah, includes that within that modeling.
Even
yes.
With shelter in place, we could still see 1,000 deaths.
Oh, yeah, absolutely.
Let me just give you the numbers, and I'm gonna tell you where these numbers are coming from. The White House, within the last 48 hours, has estimated that we could see between 100,000 and 250,000 deaths in the United States of America. Between 100,000 and 250,000 American lives lost because of the spread of this virus. Mississippi represents a little over 1% of the American population, which would suggest that Mississippi could see between 1,000 and 2,500 deaths if we simply had a rate that was similar to everyone else in the country. But remember, Ross, what I told you yesterday. The state of Louisiana, their current rate of death is 7 times higher than that of the state of New York. Why is the state of Louisiana's death toll higher? In large part, and again, these are physicians, they're the experts, but in large part it's because of their demographics. It's because of the fact that, generally speaking, many of their residents are less healthy when they initially get the virus. We tend to have older populations in Mississippi and Louisiana, and our demographics, unfortunately, are more similar to Louisianians than we are to some of the other parts of the country. And so there could be a significant amount of deaths in our state. They're going to be a significant amount. There's already been a significant amount of deaths in our state. Too many, far too many have already passed away from this virus. But as we move into this next phase, as we move into the next 10 to 21 days, it is critically important that the people of Mississippi adhere to the rules that are at hand. And if we will do that, and if we are successful in building up not only the capacity from the number of machines, the number of beds that we need, and if we're able to continue to get not only the supplies that we need, but also the people that we need to do that, then we will lessen the impact to the extent possible. Courtney Ann?
I know that you said that the strategic meeting just happened just a little while ago, but can you talk about what you anticipate that model will look like for this COVID system of care? Would it be like go teams of doctors that would go to hotspot areas? Would they likely stay in their community where they're already located? Just trying to kind of get an idea of what that might look like.
Let me clarify one thing for you, Courtney. And there was actually two meetings that were going on at the same time. We had our strategy meeting, which mainly consisted of the teams at the Mississippi Emergency Management Agency, the Mississippi National Guard, the U.S. Army Corps of Engineers, as well as the Mississippi State Department of Health. And they added team members from University Medical Center, other physicians, to help guide them. And then in addition to that, Dr. Hayes and Dr. Dobbs led a meeting of physicians talking about that piece of making sure that we had the personnel ready and able and willing to go. And so I'll let Dr. Hayes or Dr. Dobbs reach and talk a little bit about what that model would look like.
Sure. So again, this is trying to practice preventive medicine, and so the surge is not here yet, and so we're trying to identify what resources we have available. You know, Mississippi has the fewest number of physicians in the whole country per capita, so we need to be wise about how we use those resources. And so we had a collection of physicians along with hospital people, nurses, et cetera, hospital administrators, to try to help us identify what resources are available so we're ready. Right now, the physicians and the hospitals have done a good job of basically making sure we have enough beds available. We do. We've actually cut back on all the elective procedures that we're doing, and so we have a good capacity right now, but we know the surge is coming. So we need to make sure that we got the right resources in the right places, and that's what we were doing. And also to develop best practice protocols. You know, hospitals, we can learn from the hospitals in New York and Massachusetts what works and what is not working, and taking those protocols, those successful protocols, and putting them in place so when the patients come, we can provide them with the best care possible.
Joe, according to the Public Service Commissioner in the North District, Commissioner, he said that some landlords have been skirting your executive order and cutting off electricity power to the residents in lieu of residents not being able to pay rent. What's your response to that?
Well, I haven't heard that. No one has mentioned that to me. We will look into it, but our executive order is very clear that eviction notices are not allowable over the next 2 weeks during this particular shelter-in-place order. That doesn't mean that the rent's not going to be owed at some point in the future, but it is certainly imperative that everybody understands that by executive order, which has the fundamental standing of state law, evictions are not allowable in Mississippi for the next 2 weeks. Yes, sir?
Yeah, Dr. Dobbs, we've been getting some reports from health officials at hospitals that the testing is taking anywhere, the results are taking anywhere from a week to 10 days. Just wanted to ask you if there's a backlog at the laboratory, and how many tests you're getting in a day, and how
Yeah.
many do you complete in a day?
So, as we released yesterday, the total testing numbers, Mississippi in totality has done over 16,000 tests. A third of those tests are done at the public health lab, and the remainder of them are done at private labs. When we did our recent statistics, the average turnaround time from the time it hit the state lab is a day and a half. So the state lab prioritizes hospitalized patients, outbreak-associated cases, and healthcare workers who are symptomatic. So we have that set up for that reason. Some of the overflow of outpatients that may come through will be a little bit longer, but never that long. I mean, that would be hasn't happened that I'm aware of. I do know there's a slowdown at some of the private labs as well, and a lot of times that has to be shipped away. Certainly, that's something that we're keeping an eye on, and if, other than anecdotes, we'd love to see data about that, because I have heard certain anecdotes, and it's something we do want to keep an eye on.
It's from a local hospital official here, from a major hospital here in town.
Okay, and I won't ask you what lab it is. We can talk about that later.
As it relates to that number of cases, I got to thinking about it after we left yesterday. When we're looking at 16,000 plus, are any of those duplicates, if you will? Are some of these positive patients being tested again to see if they still have it further into the time?
Yeah, some of them actually are people who have been repeated, like healthcare workers sometimes have multiple tests afterwards to make sure they're cleared. So some of them some very minority, small population will be duplicate tests.
So still relatively close to that number.
Yeah, absolutely. Relatively close, yeah.
And I just want to point out, because I think it's important, again, I highlighted this yesterday. Part of our defensive strategy has included the things that we have done with respect to most recently shelter in place, prior to that the social distancing guidelines. Part of our offensive strategy has included mass testing. We have now in Mississippi tested approximately 5,600 per 1 million residents. South Korea tested 5,200 per 1 million residents and was hailed as a superstar model in terms of testing. Mississippi is approximately in the top 10 of all states in testing per capita, and that's a huge credit to Dr. Dobbs and his team, who were testing very early on at the state lab. It's also a huge credit to all of the innovation that's been done at our research facilities at the University Medical Center, at the University of Southern Mississippi, and at other areas. That's one of the things that has inspired me about this entire process, which has been extremely challenging, lots of decisions to be made, none of them easy. But what has inspired me about this is how Mississippians have stepped up and said, we're going to do what we can to help. Mississippi State University, for instance, taking that ventilator that you just saw Dr. Dobbs look at, and they're going to take the 500 of those ventilators and convert them where they are usable, and they're going to do it in the next 3 or 4 days. I mean, these are people that are working day and night to help make sure that if and when this surge occurs, that we are prepared for it, and it's really been a great thing to see.
Director Michelle, and also for you, Governor, experts are predicting this hurricane season to be severe. Have you had any strategic meetings looking out that far for hurricane season? And it seems to be on the heels of what could be a possible flattening out of the coronavirus.
Well, what I would tell you is that, and we saw it last Wednesday, I believe it was, when we had a tornado hit in Tishomingo County. The fact that this virus exists in our state, in our country, and ultimately in the world, that doesn't mean that the wind's going to stop blowing. This could be a very challenging hurricane season, and the one thing that I do know is, unlike this worldwide pandemic, the last one that we saw similar being in 1918, 102 years ago, we in Mississippi and our emergency management officials across the state certainly know how to deal with hurricanes, and our people understand when big hurricanes are coming ashore that we need to be prepared for it. So I'll let Director Michelle talk a little bit about our hurricane preparedness.
Yeah, and just let me point out too, and thank you, Governor, just to point out, let's not forget, before we get to hurricanes, we got the spring floods and tornadoes, and we're in April right now, which has historically been the most dangerous month of the year. So all that to say is we are, in fact, looking at that. We have to. waters continue to rise, Mississippi River continue to rise over in the backwater area. So that's something that we have to be prepared for. So absolutely, we look at the hurricane season and are preparing for that, which typically starts around June or run through the end of the year. So is it a concern? Absolutely, but it's something that we're looking at and being ready for.
Well, and what I will tell you is that Greg and his team literally have been at the highest level alert at the State Emergency Operations Center. They are literally working 7 days a week around the clock. And as I think about this lasting for weeks and weeks on end, maybe several months, combined with the flooding, combined with the potential of tornadoes in the month of April, combined with a hurricane season that starts sometime in late May, early June, this is going to be a difficult year for a lot of very good, high-quality people and very good, high-quality state employees. And my hat's off to them for all that they've done. Yes, sir.
Dr. Dobbs, excuse me, of the patients who are going on ventilators, and obviously those are very important devices, what percentage are we seeing of the patients actually surviving the ventilators who actually get off of them?
You know, it's really too early to tell. We also had questions about sort of like who all's recovered and that sort of thing.
What about other states where you see them?
That is well known, actually. Once a person goes on the mechanical ventilation, especially if they're older, their survival rates are generally pretty poor. It takes a high degree of expertise, and it's one of the reasons why we were really looking at the system of care, make sure we brought the right level of care to the patient to maximize their outcomes. But if you look at estimates, they're highly variable, but certainly more than half of folks, maybe 2/3, don't end up surviving if they get to that advanced stage of illness. And again, it's going to be more likely older folks with chronic medical conditions. And although a significant minority will survive and even thrive, as I've been talking to some of my critical care colleagues, it just reiterates how important it is to prevent disease on the front end, and also, too, to protect our older folks and people with chronic medical conditions so they don't get in that situation in the first place.
Are not value yet for the coronavirus in Mississippi, or are we still looking at that?
We do not. We don't have one here. I mean, we can talk about estimates, and certainly anywhere from 1.5 to 2.7 to 3 throughout the United States, but we don't have anything like that for here.
What I would say to the people of Mississippi is while we don't have a specific number of those who get on the ventilator who ultimately get off, what we do know is the best way to avoid major catastrophe with this virus is to not ever need the ventilator, and the best way to not ever need the ventilator is to not get the virus, and the best way to not get the virus is to adhere to our guidelines and our shelter-in-place order. If you are in the most high-risk categories, those over the age of 65 and those who have compromised immune systems, again, everyone sitting in this room has heard me say this 50 times in the last 2 weeks. But if you are in those high-risk categories, you must comply with the shelter-in-place order. Everyone must comply, because the reality is that you could be young and healthy and out and about and having a great time and gathering on the sandbar upriver or gathering at your local outlet, whatever that may be, and you may catch it and it may not do you any harm, but once you become a carrier, you're highly contagious, and you may give it to your mom or your grandmom or your dad or your granddad, and nobody wants to find themselves in a position where they were the ones out of foolish acts of their own in which they were a carrier and handed it to someone who then perhaps found themselves on a ventilator and didn't make it. And so please adhere to the shelter-in-place order. Courtney?
I've seen some questions coming to us about drive-up or parking lot church services where they say, well, we're going to drive up and somebody's going to be under the awning. What are you telling pastors and churches and congregations as it relates to that? Obviously, they can't be in the building. You talked about that some yesterday.
Right. Well, obviously, what we recommend is to exercise your practice of religion. The best way to do it is to stay in your home, to allow for either streaming or television services. We have, over the last several Sundays, we've actually done prayer services from the governor's mansion. My wife Ely and Emma Tyler, Maddie, and I have, and we've seen literally hundreds and hundreds of thousands of Mississippians join us to do that, and that's particularly special. And I will tell you, the people around our state that have been praying for us, we feel your prayers, and keep praying for our healthcare workers and others. For me personally, I would prefer that pastors not do that. And here's the reason why. I'm not a health expert, but if you're in your car by yourself and you drive from your house and you sit in the parking lot and you stay in your car and you leave your windows up, it's not likely that you're going to give this virus to anyone. But what I have seen in the stories that I have heard, even on those who mean well, is that we are naturally a people who like to socialize. And so I have heard from people who have done that, and they've said, Governor, you just don't understand that, we all went, and we stayed in our car, but I watched all of my friends stayed in their car until the pastor stopped preaching, and then invariably you saw one up here get out and go and shake the hands of their friends in the car next door, or they get out and they go a couple cars down and say hello, and that just defeated the whole purpose of the social distancing guidelines that we put in place. And so I certainly don't believe that government has the ability to close churches. I believe churches have the ability to offer services, but there are strict guidelines. No more than 10 people can be gathered in any one location. And what ends up happening invariably, I'm afraid, at these church services, and it's people with the best of intentions, it's just hard to overcome our natural tendency to get out and say hello. I don't know if anyone else wants to address that question or not. But
Yeah.
I got a question for Dr. Dobbs. You were talking about the 500 ventilators going to MSU, but you refused to release the number of ventilators that we have in the states. So how does the people of Mississippi know whether we have enough ventilators if you won't divulge the number of ventilators we have in the state?
I appreciate y'all's passion for getting this number. And certainly any information we can provide, and certainly if you look at what's happened over the past weeks as this has evolved, we've increased the amount of information available to you guys and to the public. And certainly we're going to add more information. We're going to start reporting out number of COVID patients in ICU, number of COVID patients on ventilators, and that makes sense. And in regard to the ventilator numbers, although I know Louisiana does do it, most of the states in our area do not do it. And if there's not a public health reason to not report it, such that the thing that is of some concern to some of us is that a number can provide misinformation. And a ventilator is not a ventilator because there's a lot of variability in this. If we can find a way to report it in a way that communicates the availability properly, we will certainly do that. So we're still looking at it, but a frank number of ventilators doesn't really communicate the availability that most people would interpret it that way.
But I mean, you should just put that number out there and let people know. You're saying some of these ventilators are not really ventilators?
Yeah, some of them are surgical anesthesia machines that can function as ventilators. So if let me just tell you, Ross.
How many actual true ventilators
Yeah.
does the state have?
We have a sufficient number right now. But we'll look at sharing more information with you guys. And I know you're just dying to get it, but there are things that we share that if it's misinterpreted is harmful. And so that's something we really need to think about.
let me say this, Ross. In looking at the number of ventilators that we currently have available, it obviously changes every single day because you have people come into the hospital, you have people who leave the hospital. When you look at the number of ventilators that we currently have available, when you look at the number of ventilators that we are retrofitting, either from the AmSurg centers, as many are actually larger hospital facilities are taking those machines that they have in their AmSurg centers, which again are not, they don't have all the bells and whistles of the ventilator that's sitting in the ICU room, as I appreciate it. But when you take those, you take what we have being converted at Mississippi State University, and then you consider the number of ICU beds that we have available. You also consider the potential, the possibility of implementing, again, in a worst-case scenario, the New York model, whereby, for instance, there are some facilities in New York, and I believe the FDA has said this is acceptable, and I believe the State Department of Health has said this is acceptable. If they haven't, I'm sure they're considering it. The New York model, whereby you put 2 beds in one ICU room. When you look at every scenario that we look at, and with the exception, of course, of the worst case scenario, our biggest challenge is not going to be the number of beds or the number of ventilators. Our biggest challenge is to make sure that we have adequate and competent staff to be able to do it at the right facility. Because I can tell you that I have 1,000 of anything in Mississippi, but if I have all 1,000 of them in Tishomingo County and the outbreak occurs in Hancock County, having 1,000 in Tishomingo County doesn't do me any good, because the average would tell you I got 1,000 in Tishomingo County and I need 1,000 in Hancock County, and so in the state of Mississippi we're fine. Well, we're fine except for unless you're a patient in Hancock County, and so that's the reason this meeting that took place today that Dr. Hayes led is so critically important, because it's about not only having adequate resources, but making sure that those resources are wherever they need to be at the time they need to be there. And the big challenge with that is, if you told me today what I was going to need 10 days from now in Jackson and what I was going to need in Tupelo and what I was going to need in Gulfport, I think we could probably all sit in here and say, well, this isn't that complicated, let's just do it. The problem is that information changes every single day, and so we've got to plan for every scenario. And what I'm here to tell you today, and what I'm telling the people of Mississippi, is that we have the best and the brightest from the medical community in our state that are committed to doing everything in our power to make sure that none of those issues become a major problem in Mississippi.
Yeah.
We can't plan for everything, but Dr. Hayes?
I'm sorry, I didn't mean to interrupt. That's one of the things. You're exactly right. So it's not just about the machine. I mean, physicians are problem solvers. We deal with problems every day. And how are we going to take care of an issue? And so we're learning from our friends in other states, and we're communicating with physicians. We're not just being in a silo. We're learning what they're doing. And again, we're trying to bring best practice, those protocols where people are finding challenges. All right, so maybe we can repurpose a ventilator. Maybe we can put 2 people on a ventilator. There's a lot of different scenarios. So being fixated on a number is probably not the right thing. I mean, we can use different machines in different ways. So we're going to solve the problem. We can do that. I'm very confident in the healthcare team. It's just not the physicians. It's respiratory therapists and nurses, and trying to use ideas about how to use telemedicine. We were talking about a buddy system. Okay, maybe one hospital doesn't have a critical care specialist, but maybe we can get one for them with using telemedicine. There's a lot of things, a lot of ideas that we have that we can put in place to take care of patients.
Just like UMC has been innovative with respect to testing, just like the University of Southern Mississippi has been innovative with their approach to testing, just like the State Health Department has been innovative with their testing models, just like Mississippi State is currently being innovative in the conversion of these ventilator machines. I am convinced and I am committed that the top health experts in Mississippi are going to be innovative to find solutions. Again, assuming the most likely scenario, we are going to put ourselves in a position where we're not in the same position that other states have found themselves in recently. But remember, every state is at a different point in their cycle today. And that's the reason every state has to make the best decision on every issue for the specifics that are before their state. Yes, ma'am.
Not as much a question of ventilators, but of ICU beds. Early on, or I can't remember how many press conferences back now, you talked about that some of the rural hospitals might be converting some of the additional space they had. I know that question does come back to staffing for that, but do we know any kind of estimate or a number on how many of those rural hospitals have started that process, perhaps?
I'm not sure what you're referring to.
I think that you had mentioned that some of the rural hospitals and some of the others had additional space after the bed count going down over the past few years, and that some of them may be able to retrofit some of those spaces for additional ICU beds.
Oh, I see what you're saying. Yeah,
and so
yeah.
do we know how many of those rural hospitals or other hospitals have retrofitted additional space to become ICU areas?
Great question, because it gets back to this whole other issue with the system of care. So one of the things is not getting the patient to a room, it's getting the patient to a team. And if the teams are in these certain areas, that's what's going to happen. So, the current model we're looking at is getting the patients to where they can get the best care. A lot of our health systems have been extremely innovative in identifying ways to expand ICU capacity. I would say, without a doubt, every health system that has a robust ICU system has found ways to increase their capacity from 50 to 100%. So basically doubling ICU beds by looking at innovative strategies like using unused operating rooms as ICU rooms, or using other sort of like procedure suites or unused rooms in the ER. I've seen a whole bunch of different models. So that's very promising because that's where the expertise is and that's where they can get the care. But the other part of this thing we're looking at is alternate care sites, which is going to be really similar to the concept of using these other unused areas where when people are convalescing or maybe they're not acutely ill, we need to decompress the centers of expertise. We can find locations for people to spend the time for recovery and then use the entirety of the healthcare system.
It's one of the interesting data points in where we find ourselves in America today. This is true in our state, but it's true in every other state as well. And these docs can speak to it better than I can, but I happen to have a good friend who's an ER doc in another state that I happen to be on the phone with recently. And their caseload in their ER in a very large hospital in a very large community, non-COVID related, was down 35, 40, 45% because people are staying at home, so there's not as many car wrecks. It's a simpleton like me can understand that. And so, but that goes on and on and on to speak to, there are a number of things that are happening within the healthcare system which gives us an advantage because those physicians are now available to step up, maybe not in their exact area of expertise, but step up and help the system.
Right. So there's something called collective intelligence. We talk about, what one person may be really, really smart in one area, and there may be somebody else that's really, really smart in another area. But when you put the two together, it multiplies. And so that's what we're learning as people are having the time to go read, to learn, to call their other people in their national associations. What are you finding out that's working? We can use that collective intelligence and apply it here to our state. So it's kind of exciting, to be honest with you.
Yes, sir.
Yeah, a question for Director Michelle. Sure. You said that the state is delivering PPEs to hospitals, I believe 67 hospitals, and other tier 1 facilities. That would include nursing homes, correct?
If they're nursing homes that they are actively treating COVID patients or have them in their facilities, they would be considered that, yes.
So the ones that I think there's 20 counties that have nursing homes that have outbreaks right now. So you're delivering supplies to those nursing homes?
As we get them and we get them out, yes.
Well, what are you seeing in general? Are you seeing that these nursing homes have enough supplies, or what are they in need of?
Most of the facilities are like the tier 1 hospitals. They do have some supplies, but they're getting, as has been said here a number of times before, they're getting a little low. So fortunately, our supplies are coming in at about the time. Now, we do have facilities out there that in some cases have run out that are not treating COVID patients. What we've seen is a good level of cross-leveling of those PPEs where necessary, and that goes back to the points made here. These facilities work very well together. But back to your question, we are getting that PPE out to those facilities as we get it.
So in general, they have enough masks. The ones that have outbreaks, that the workers have enough masks and gowns.
They have adequate masks. If you ask them if they have enough, you would get varying opinions on that. I mean, we in a lot of cases, it comes down to the PPE discipline because we're seeing varying levels of that. They've been good to reuse those masks, in some cases more than they probably would on a normal circumstance, but to get them to where they are. It's varying degrees, but we keep up with as best we can through those emergency managers in those counties.
Yeah, if we as a state thought that we were going to go in a similar state of affairs for the next 90 days, I would want to be able to sit here and tell you I've got 90 days of equipment for everybody in the state that I can distribute. And I'm sure every hospital and every primary care facility would like to say the same thing, that in their own facility they have 90 days. Well, that's just not reality in today's world. The reality in today's world is as we get more and more stuff in, and we are every single day, we are distributing it. And as we move further along in this crisis, more and more private sector entities are coming online. There's more production being done on masks and other things. And I can tell you we are working diligently day and night, finding every single possibility to find those masks. I know we've got, how many did we get in today?
75,000.
75,000 in today. We got a lot more to do, but that's at least a step.
Governor, I got a couple questions.
Okay.
Can you talk about your request for a federal disaster declaration? And also, this got a question from a teacher wondering when are you going to announce the shutdown of public schools for the rest of the year?
Yeah, I'll answer the second one first, and then I'll answer the first one second. There's been no decision to shut down public schools for the rest of the year. You will notice that our shelter-in-place order, which starts at 5 p.m. today, goes until 8 a.m. on April the 20th. That coincides with how long public schools are shut down at this moment. We're going to monitor things over the next week to 10 days and make a decision about schools as soon as we make a decision as to when the shelter-in-place order may go away as well. And so we'll make that decision in the coming days and weeks. With respect to the emergency declaration, what I would tell you is that I am absolutely confident that Mississippi will be declared a major emergency because I believe that all 50 states ultimately is going to be declared a major disaster declaration. And so while we have asked for it and I expect it to be granted, we are waiting on the final piece of that. Director Michelle, you want to mention that?
Actually, a follow-up. What does that mean? How does that differ from the stimulus bill that's going to be funneling money to different entities, counties and businesses that are affected by COVID-19?
And I'll let Dr.
Yep. So again, go back and add, we actually just got notification today from FEMA that they actually have our emergency declaration in the queue. That is also includes the 502F, which is the funding stream for the National Guard. They have that. We should be getting an answer back on that. And it has nothing to do with the fact, well, we got it in, too late or too early. It had to do with when we got our first case in Mississippi. So we're in line with that. As far as the other type of funding, Governor, you want me to address that as well too? The funding that'll come through that, much like you've heard me talk before about your public assistance and your individual assistance emergency declarations, that will be very similar, even though we'll be looking at some different type of response expenses, if you will, PPE being one of the bigger ones. On some of those things we'll be making claims, and those will be emergency disaster assistance that we will be getting. PA was automatic with the president's emergency declaration. The individual assistance is what we submitted for, and that is specific to Mississippi.
Would that be businesses that have been impacted?
So your businesses are going to primarily be covered through the SBA assistance, and there's 3 types of assistance that will come through with that. We've gotten enormous applications. We're assisting that through my office, through my IA, and we've had obviously we've had a lot of calls, and we're helping people put those together.
And that's different from the $2 trillion bailout?
Correct.
It is different in the $2.2 trillion that was in the bill signed by the president exactly a week ago on Friday evening. There is significant benefits for small business owners. There's significant benefits through unemployment insurance for individuals throughout the state, and we are working to get that information out to everyone in our state.
Do you have an update on the Department of Corrections, if there have been tests done, and 2, if there's a plan in place if someone does come up positive, how to isolate and limit?
Yes. So there has been as I understand it, there has been an individual tested. There has been no positive test. No prisoner that is currently in a facility has tested positive at this time. We are working very closely with the Department of Corrections to ensure that social distancing guidelines, to the extent possible, are being enacted. And basically what that means is the entire system is taking significant precautions and almost in quarantine by and large. But we do not have a positive test. And I think I mentioned this the other day. If I didn't, I meant to. The way in which we're doing this, we have had patients who are sick in the Department of Corrections. As any group of 20,000 people over the last 3 weeks, you would have come up with some people who are sick. So the protocol that they're using is if someone were to come up sick or not to feel well, we send them to the infirmary. As is always the case, when they get to the infirmary, we first test them for the common flu. We then test them for strep throat, and at least prior to today, everyone that fit into that category had tested positive for one of those two, and so there wasn't a COVID-19 case. In addition to that, we also cut off visitation to our prisons to keep that COVID-19 from coming into the facilities, because we know that that's critically important.
And what's how are you working with some of these bigger factories like Sanderson Farm and other, even on the Gulf Coast, where they are some essential, but some people may come up with an illness? How are you working to mitigate that?
Well, we've been providing our business community guidance for weeks on end, and I've got to tell you, I think without question they have stepped up and are doing everything they can to ensure the social distancing guidelines, that most people that can work from home are working from home. I've talked to employers even who are literally doing a temperature test before their employees are allowed to get on the factory floor, get on the floor in these essential businesses. We are certainly, you'll see if you try to get in the state EOC right now, we're doing temperature testing as well, because we do have a large number of people who don't have the luxury of sitting this one out. This is their job, and they take pride in it. But we are protecting everyone by doing temperature tests, including myself, who went in the state EOC earlier today. And so we're encouraging our large businesses to do that as well. And most of them, as I've talked to them, have set up guidelines and are doing what I would argue is doing a good job at that. Yes, sir.
Follow up to this question about MDOC. There have been 2 deaths in Wilkinson County. Are they from the private prison or not? There's a private prison in Wilkinson. Are those 2 deaths from there, or do we know?
I'm not aware.
I'm not sure.
Yeah, I'm not.
What are the guidelines for the private prisons? Are they the same as MDOC's, or do they have to follow those, or what? Do we know?
I mean, well, and I'm not an MDOC expert or corrections, but the federal ones, you mean a federal one or the state ones?
Or the private prisons?
I mean, some of the private ones are also federal.
Right,
Okay.
federal inmates at a number of them, but I know the federal system, I think I read earlier today, has has basically gone to a quarantine system as well. But again, I'm not an expert on that. I have not been alerted that any of those deaths have come from the prison system.
I asked you this question yesterday, but it's worth reiterating. We're about 30 minutes from the shelter-in-place order going into effect. What's your message to the people to, I guess, essentially not run out and take everything off the shelves?
Well, the supply chain in America is working. Americans and Mississippians have stepped up in this time of need. They're doing the right things. What you need to do is when you go to the grocery store, you need to get yourself what you normally would buy for a week to 10-day supply to make sure that you're not hoarding. This is the time for caution. It is not the time for panic. And while I can't stress enough how much this disease spreads and how easily this virus is spread from one person to another, what I can tell you is we're going to continue to make sure that the grocery stores stay open. We're going to continue to make sure that there's product on the shelves, and we are going to work and ensure that Mississippians will take care of themselves. But if you're over the age of 65, if you are in that category where you have a compromised immune system, and I've been urging the church-going folks around Mississippi to look in their own church, talk to their preachers, identify those people in your church that are in that particular category, and why don't you call one of them and say, hey, can I go get you groceries today? Mississippians throughout the state want to help. I mean, even my own friends are texting me saying, what can we do to help? Well, that's what you can do to help. You can go to the grocery store for someone who has a compromised immune system. And that may be someone who maybe had a cancer treatment recently. That may be someone over the age of 65. That's how you can be a hero in this, is to help those that are in the highest risk category stay away from other people and lessen the risk that they actually get it and need one of these ICU beds or ICU rooms or ventilators that we're talking about. If we can keep more people off of those, we'll have better numbers at the end of this than if we cannot. Seeing nothing else, thank you all for being here, and we'll be back with you soon. And thanks to these 4 gentlemen for being here today. They really added value.
I'll never be shaking anyone's hand anymore.